Okay, welcome everybody. We are a few seconds away here, but I'm spinning everything up. So just give me a second and we'll get started. Okay, so thank you everybody for joining. I am Jonathan Stanley, and I am with Vanguard Communications, and I'm here also with Angela Dooley and Dr. Neil Baum, and we will be discussing COVID-19 and how telemedicine rules have been changing with regard to HIPAA, and what practices can do to adopt or to adapt in this quickly changing environment. So. We will also be taking questions at the end. So if you do have questions, feel free to go ahead and post them in the chat. And we will be answering those for a few minutes after our presentations. So first you'll be hearing from Angela Dooley, then Dr. Baum, and I will wrap us up, and then we'll be taking questions. So with that, let me pull up Dr. Baum's information and we will get started. Oh, I'm sorry. I'm going out of order, aren't I? Angela, I will pull up your information. Okay.
Thank you. My name is Anjali Dooley, and I'm an attorney, and I also have my business MBA in entrepreneurship. I am based out of St. Louis, Missouri. Hold on, I'm going out of order. So I have my own law firm. I've been in healthcare and technology lawyer for many years now, 10 plus years. I've been an attorney for 17 plus years. I am a leader in the American Bar Association's health law section. I was general counsel of a telepsychiatry company out of California and Silicon Valley, and we grew their practice from 7 states to 30 states in a very short amount of time. So I'm very well versed in telemedicine and the rules and regulations that are revolving around telemedicine. First, I wanted to talk about what's going on right now. What's going on right now is all the rules have been loosened for telemedicine, including provider licensing rules, reimbursement rules, telepharmacy pharmacy rules. Everything has been loosened to allow for telemedicine to expand. However, that does not mean that you just go out and implement telemedicine into your practice without really thinking it through. Now, you might have to think it through quickly, and obviously Vanguard and myself and or Dr. Baum can offer help, but you have to think through on how you can implement it into your practice. One of the things that we want to talk about is standard of care. Standard of care will not change just because it's a telemedicine visit. Standard of care is defined as what a reasonable, thoughtful, prudent provider, physician, nurse, physician's assistant would provide in a similar circumstance. It has not changed. So one of those things is that it has not changed. So be aware that the standard of care is the same for a telemedicine visit as it would be as an in-person visit. Standard of care, as we know, is often specialty driven. For malpractice, contact your malpractice insurance carrier, making sure that you are allowed to do telemedicine visits. It's also, as we know, local based. So as the licensing restrictions have lifted, you have to realize if you see a patient in another state, it's that state's laws that will coincide with your malpractice. If malpractice is committed or outside of the standard of care. Standard of care, as I said before, is same as an in-person visit. Practical point in all of this is define what type of patients you would want to see in a telemedicine visit and have your coding ready for those visits. I think Dr. Baum will go over that a little bit more. We also want to think about scope of practice. What is the scope of practice allowed in your, based on your education training? You don't want say an orthopedic surgeon or a urologist or going outside of the scope of their practice and seeing something that they're not aware of. You have to be, be able to see or refer your patients to the right professional to be seen. So stay within your scope of practice. Right now, you still need PA and MP collaboration and supervision agreements in most states. I know there are certain states that allow for independent or autonomous practice of nurse practitioners. However, if your state requires a collaboration or supervision agreement, you can supervise via telehealth as well as collaborate via telehealth, but make sure the agreements are in place. Scope of practice, again, is specialty driven. And again, try not to practice outside of your scope. I also wanted to go over some types of telemedicine communications. There's different types. The AMA, CMS, OMB came down with, okay, you can have a new patient visit as well as a established patient visit via telemedicine to keep them out of the hospitals, keep them out of from visiting your offices and keeping them at home. There's different types. There's text message, there's telephonic, just picking up the phone, and there's video. There's two types of text, and there's asynchronous text and synchronous text. So asynchronous is often providing education, images, and you can save these images on your phone, send it to your patients over time to create some patient engagement. Synchronous text is that you're talking to the patient in real time back and forth. We'll go over some of the practical standpoints of text messaging as well. Telephone is just picking up the phone and it's real time talking to your patient over the phone in a regular phone conversation or advice that you've done in the past. Video is obviously a video recording or moving where you can see the patient in real time and assess any conditions that the patient may have and give advice in real time over video. And I'll go over some apps that are HIPAA compliant and non-HIPAA compliant. I really don't care if they're HIPAA compliant or non-HIPAA compliant. From my legal standpoint, I would highly recommend to not hit the record button. I know some physicians would like to record it and then save it for later. Have your memo or notepad or scribe ready if you can to take notes as if it was an in-person office visit. Otherwise, if you hit the record and you save that record, it's there and it's a gold mine for personal injury attorneys to discover if should there be any sort of malpractice ramifications post-pandemic. Physicians can use these apps to communicate with patients. So these are non-HIPAA compliant apps, meaning that these companies, when you're using these applications, do not sign a business associate agreement. And I'll go over the business associate agreement in my next slide. They can use Microsoft Skype, Apple FaceTime, WhatsApp, Facebook Messenger, Zoom with healthcare. They have a Zoom healthcare. This is not an exhaustive list, but there are several one-on-one communication apps that a patient and provider may use that are not non-HIPAA compliant. Providers cannot use TikTok, Twitch, Facebook, Snapchat, any application that's public facing and definitely not secure. So I went over some non-HIPAA compliant apps, but there are several HIPAA compliant apps. And one of the things that a HIPAA compliant app does is they will go ahead and sign a business associate agreement. What is a business associate agreement? In simple terms, it's an agreement between the covered entity, which is a provider, and their vendor who's providing them the telemedicine service to safeguard personal protected health information. So if you can implement at this time a HIPAA compliant platform, you should go ahead and do so. This documentation will allow you to, one, to continue to use the platform post this pandemic situation, but also has a documentation that you were reasonable and you were trying to do the right thing. When you start telemedicine and you do have a patient population, whether it's established and or a new patient, get verbal consent while you're on the platform, whether it's telephonic, text message, or video. Get a consent or a text message consent or a verbal consent and document that consent that this patient is consented to be seen via telemedicine, and that they're authorizing me to give advice via this mode of communications. Some of the HIPAA compliant platforms that are approved are Zoom for healthcare, Google G Suite, VC, DoxyMe, UpDocs. This is not, again, an exhaustive list, but often if you need advice on which HIPAA compliant platform to use, please contact your legal professional or compliance professional within your organization, and or obviously feel free to contact me and I can guide you towards the right platform, and review the business associate agreement to make sure there's no issues in should there be a breach that occurs during this time. This is also a concern for many providers. With whom can you really share information during the current HIPAA privacy waivers? CMS brought down, the first thing that they brought down was HIPAA privacy waivers. Obviously, you can share information about a patient that CDC and other state, local government that you think that is, has COVID issues or needs to go to the hospital, other persons that are at risk of contacting the novel coronavirus, law enforcement in special circumstances, if you think there's an imminent threat to public or public safety, and family and friends that, again, may have been exposed to the coronavirus. But again, best practice is to keep minimum necessary disclosures. I just want to have an important reminder. Use some common sense. I think common sense is all of you that are watching the program and providers have some sense on what they can and they cannot do, especially if you've been in practice for many years. Use some reasonable measures, document, and keep the information as secure and private as you can. Use platforms that use a consistent platform if you're using a non-HIPAA compliant platform. So example, if you need to use FaceTime for your iPhone users and some other Google Hangouts for your Android users, go ahead and use that, but be consistent on the platforms that you may be using. Here's a few more practical guides. If you have an EHR and you already use an EHR, you can download text messages into text message communications and input those into your EHR. Also, contact your EHR vendor. They often are already strategic partners with telemedicine vendor platforms, and they might already have something in place where you can communicate automatically with a telemedicine through telemedicine and upload that into your EHR for documentation purposes. And I cannot emphasize enough to document, and as if it's an in-person visit. And so not only can you cover yourself for any sort of claims, but also you get reimbursed for these visits. And with that, I'm going to hand it off to, this is my information. If you want to contact me, my website is going up in the next 2 weeks, but feel free to contact me at my firm or through my phone communications, and obviously I will answer your questions as quickly and promptly as I can. And with that, I would like to hand off to Dr. Neil Baum.
Great, thank you so much. So that gives us a great legal perspective. And Dr. Baum, I'm pulling up his presentation for a medical perspective. So Dr. Baum.
Anjali, what an excellent presentation. And I think you emphasize the importance of having legal counsel regarding this new method of communication. Yes, the guidelines have been relaxed and we could become complacent and perhaps communicate with patients in a fashion that is not fully HIPAA compliant or is not appropriate to do when those guidelines have been lifted. You can be sure that this window of opportunity is going to be temporary and transient. And consequently, it is going to be very important going forward that you don't use the same methods that you're using today with the relaxation of the guidelines, and use those going forward, because things are going to change. It may not go back to the way it was, but it certainly is going to be different than the atmosphere that we have today. I believe that telemedicine is going to be an opportunity to fill our glass. I think that we see this as a great opportunity, and it's a great opportunity to engage patients in a fashion that we never have before, but we are still able to practice good medicine without the necessity of having to be eyeball to eyeball with the patient or the necessity of having to touch a patient. Little bit about myself. I am the medical advisor for Vanguard Communications for the past several years. I have been in practice over 40 years and currently have a clinical appointment with Tulane Medical School. I have written 10 books on practice management and improving the efficiency and productivity of a medical practice. My areas of interest are social media and telemedicine. One of the books that I have written, shown in the lower right-hand corner, Marketing Your Clinical Practice, is in its 4th edition, has been translated into Spanish, and has sold now over 200,000 copies. So what do I want to cover today in the next 3 to 5 minutes? I want to talk about the use of telemedicine to connect with your patients. It's an opportunity to connect with existing patients, and it's an opportunity to attract new patients to your practice. I'm also going to talk about the importance of documentation. Anjali said it so well in her presentation, and she said it 3 times: document, document, document it. And I'll say it once more and I'll tell you why that is so important. Jonathan Stanley will then cover how to use free video chat technology, and you can be using telemedicine immediately in your practice. So telemedicine is an opportunity to increase your access to care with your patients. Patient calls you and asks for an appointment. In the past, that could be days, weeks, or months that they would have to wait to get an appointment. Now you can communicate with them same day, or you can communicate with them easily within the next 24 hours. You are providing an enhanced convenience for your patient. The example today is a patient calls and has a brief question. Do I need to have a face-to-face visit? Do I need a test? Do I need a procedure? The doctor can answer that. The patient doesn't need to come for an appointment. And if it's documented, the patient can bill the physician can bill for that interaction with the patient. But documentation is so imperative for these virtual visits. My rule of thumb is if you didn't document it, you didn't do it. If you didn't do it, then you're not going to get paid for it. I can assure you that documentation is the key to making this communication technology successful. If doctors are just communicating either by phone or by audio and video, and they don't document it and they don't get paid for it, its attractiveness will be absolutely zero. So, how can you document those visits with patients? If you're using one of those free video chats, you can write everything down. And what you need to write, it's very simple. It's as if you were having a face-to-face visit with the patient. If you were having a face-to-face visit with the patient and you had your electronic medical record, you would write down the date, how long you spent with the patient, the duration of the conversation, your diagnosis, your recommendation, your prescriptions that you are recommending, and then you can properly code for that visit, and you can submit that through your electronic medical record. I'm making the assumption that most of you have electronic medical records. Consequently, you can record that real time on your PC at home. You can use your mobile devices to use your electronic medical record and to document that visit with the patient. This is so important because this allows you to create a viable code that will allow you to be reimbursed for that visit. So my take-home message is this is a great opportunity for us. Our glass is half full. We can avail ourselves to this technology. We can use it immediately. There is relaxation of the requirements that are needed to properly use telemedicine. I'm recommending highly that you have legal guidance regarding the use of this technology. And I hope I have emphasized to you the vital importance of writing down everything that was said with your communication using this technology. Jonathan Stanley will take over, and he's going to share with you how to use these popular free apps for telemedicine during this time of challenge with in the healthcare community and with our patients. Thank you.
Great. Thank you so much, Dr. Baum. Okay, so I am Jonathan Stanley, and I'm pulling up my slides here. Great. Okay, so I'm Jonathan Stanley. I've done everything I can think of digital since 1998 or so. I've built websites. I've done digital marketing. I've done digital advertising. I've done computer programming. You name it, I've probably done it if it's on the web. I've been deeply involved in HIPAA and healthcare since about 2009. In fact, I've spent so much time working on compliance with HIPAA, I've actually found typos in the Code of Federal Regulations that I think are still unresolved, actually. But I am an international speaker on health practice security. I've worked at Fortune 500 companies all the way down to sole proprietorships. So it really runs the gamut from small to large. When you do good practices, that tends to work everywhere. I am the technology director at Vanguard Communications. And what we do is we focus on healthcare practice growth. So one of the big things I think a lot of practices are asking is what is the official guidance? What are the officials telling us all the way up in these government offices? We have one of the first ones would be from Roger Severino. He is the Office of Civil Rights Director, and a statement from him is that we are empowering medical providers to serve patients wherever they are during this national public health emergency. Very clear that this is a big change. It's coming from the director of the Office of Civil Rights. I'm sorry, I skipped a slide there. We also have Alex Azar. He's the Health and Human Services Secretary, and he said that more older Americans will be able to access healthcare. They will be able to access healthcare they need from their home without worrying about putting themselves at risk during the COVID-19 outbreak. So again, we see from the highest levels a push to get access to healthcare, even though patients and doctors are having to remain at home. And we have a similar statement from Seema Verma, the Centers for Medicare and Medicaid Services Administrator, said that CMS is taking immediate steps to give our nation's providers, healthcare facilities, and states maximum flexibility. So you look at this as a whole, there is a really big HIPAA pause on in purpose of enabling telemedicine for healthcare providers. So the reasons for this are probably pretty self-evident, but that video chat is safer for healthcare providers, it's safer for patients, and it enables access to healthcare while at the same time maintaining social distancing. So many of us are working from home, and we can continue to access our healthcare remotely, and doctors can continue to access their patients remotely. So this is a great opportunity to work with those things, since we're otherwise so many times shut down. So what apps can we use? And Anjali has reviewed some of these, and I'm going to review them as well. But it really is, when I hear the word telemedicine and telehealth, I think of some difficult, complicated, expensive, confusing, frustrating system. And in fact, that's not necessarily the case. It doesn't have to be the case, certainly. The restrictions have been lifted for the time being during the coronavirus pandemic, that basically any private video app can be used. So that includes Apple FaceTime, Microsoft Skype, Google Hangouts, Facebook Messenger, and Signal. WhatsApp. This is not an exhaustive list. There's many, many apps that do these sort of things, and many of them are even free. But for those practices that want to do an option that will be durable beyond the coronavirus, you would want to get one that is offering a business associate agreement. So, for example, Skype by Microsoft and Google, G Suite's Hangouts Meet are both offer a business associate agreement, and they both offer video teleconferencing in a private session. So those would both be able to be used beyond this time. There's many other options as well, but that just gives you a sense of really this is opening the doors to many options that were not previously available. And as Anjali mentioned, this does not include public-facing apps like Facebook Live, Twitch, TikTok, Slack. All these apps that are broadcast-oriented to an audience are not what we're talking about. We're talking about private, non-public-facing apps. So some practical considerations as you evaluate which software you might choose. One of the most important things is, what can I get immediately set up? And I would say some things to realize is you're not limited to only one. You can use multiple. You can try one and see what sticks. And every practice is going to be different. So you might think that one is going to work and then realize the next day that actually there's some problem with that one for your particular system. So for example, if you're tied in with Microsoft email, you might prefer Skype, since it ties in with Microsoft products. If you're with Google, you might prefer Hangouts Meet, because that is tied in with Google's email system. So there's so it's every practice is going to have their own differences. Another question is going to be whether these video conferences, sorry, I keep saying conferences, it's not a conference. Video chats are private, so not a conference. But will these video chats be reimbursable? And the Centers for Medicare and Medicaid said that they will reimburse providers for telehealth just the same as in person during coronavirus pandemic. So there's no change in CPT codes. There's no authorizations. You do the same process that you do as if the patient had come in person. Okay, so some of these systems require you to disclose your provider's email or phone number. So for example, a lot of people really like using iPhone FaceTime. The caveat with that is, of course, that when two people call each other, they both have to know each other's number. And in some cases, practice may not want to give all of their providers direct phone, their patients direct phone access to their providers. And in that case, you have to be a little bit cognizant of which apps you're choosing, because some of them, just decide whether that's the type of communication that you're going to want. So Skype and Facebook Messenger and Google Hangouts can be set up that you don't have to disclose that sort of information. So something to think about there. Another consideration I think is very important is what the patients actually prefer. So FaceTime, for example, has, I think, over 1 billion users. So it's extremely patient friendly. And Hangouts and and FaceTime and Signal are also very user friendly, but not necessarily the most secure, but with regard to Facebook, but they are certainly patient friendly. As far as trustworthiness, I would certainly put Signal Messenger at the top of my list of security. And although they don't offer a business associate agreement, they are extremely high quality in their security measures. FaceTime and Google Hangouts are also are trustworthy as well. And then we have the question of durability past this temporary lifting of rules. And I think Microsoft and Google Hangouts Meet are both good options for that. So when you put this all together, you see that there's no one option that's going to be a perfect solution for every practice. It depends on what systems your EHR and practice management system that you're using, what sort of email system you're using, what sort of access you want your patients to have, how much value do you place on security and trustworthiness versus accessibility and user friendliness. So as you can see here, that's going to range. But what I would really guide you to is that you don't have to you're not going to know necessarily what the perfect solution is. So use what's easiest for your team. If you have several people in your staff that are really happy to use iPhone and FaceTime, then maybe that's a good option to try. There's also the common situation that we see is a patient might reach out on Facebook, providing their PHI over Facebook, and the practice has to typically respond with the standardized response that we cannot answer these questions through Facebook. But in this limited instance, you can actually answer those questions. So if you are getting people messaging you through private channels on Facebook, that you actually can respond privately on Facebook, even though this would normally not be HIPAA compliant. And these times you can. And if you're still not sure, I would encourage you to follow what your patients are requesting. And lastly, again, Signal is certainly a very secure option if that is something that you want to place a high value on. Oh, and just to mention as well, Signal Messenger does not offer a BAA, even though they are, I think, among the most secure. They do not offer a BAA, and they are a 501c3, just to clarify that. Okay, so this next section is on modern communication, and this is really geared for those practices that are maybe receiving a lot of self-pay patients or elective procedures. And right now we've seen so many practices being effectively shut down because these procedures are not allowed to occur right now, and we also can't see new patients come through the door and get our future patients, started up. So I'd like to give some options for these, that these practices can survive in this difficult situation. There's three things that I think are important. One is to post notices everywhere. If you are going to offer telehealth, some sort of video chat system, let everyone know as best you can. And a great way to do that is through your website. Of course, you'll also want to do it on your voicemail and even on your building front door. But if you do post it on your website, I would encourage you to make sure that it has sufficient prominence, that all of your visitors can see it. But at the same time, make sure that it's limited in dominance, because what you don't want to do is scare patients away or send them into a panic. The whole point of this is to give people access to each other in this time. And the last would be to make sure that the message is both desktop and mobile friendly. In our practices that we work with, we see typically the vast majority of website visitors are coming from mobile devices, not from desktop. So it's very important that you make sure the message works on mobile if the majority of your visitors are getting your website through that way. The second piece is transparency. People love hearing from their doctors. They love their doctors generally, but they really love hearing from their doctors. And they also love their doctors listening to them. So the patient's number one complaint is actually typically has to do with communication. So this isn't just common sense. I've actually published research that demonstrates that the majority of patient complaints tend to be about communication, not about diagnosis problems or bedside manner or something like that. It has so often to do with communication. And while we are sort of forced into finding alternate means of communication through video apps, this can be a very good opportunity to be ahead of the curve and connect with your patients in the only way that you can. So this actually can be an opportunity to connect to your patients. So if you want to do a big step above, so some of these apps require an installation, require special software. They may be free, but they also can be difficult to use, especially if you have an older patient population or something like that. But live chat, I think, is an excellent option if someone really wants to get connect as closely as they can with their patients. And the great thing about a live chat on your website is that there's no app that you need to run. There's no risky installation for you to worry about. There's no account for the patients to have to sign up for. It is literally anyone that visits your website can click a button and start chatting with you or your staff directly. There's many services that do this. One great one is intercom.com. Again, just the disclaimer that this will not be something that you can use forever. This will only be allowed during the coronavirus pandemic. But for now, if you'd like to really connect with the patients, I think something like that would be a great option to do. And by the way, those live chat icons, when those little pop-up bubbles, when those pop up, you can see sometimes a 10 times higher engagement from your website visitors than you would otherwise see. So it's extremely well received from the public. So as a summary, you can use really any video chat app that you feel comfortable with during COVID-19. As long as it's a private video chat and not public facing, you can use the app that you really feel best about. If you need help, just so you know, our practice at Vanguard Communication specifically works with healthcare practices to grow them between 15 and 30%, and we actually guarantee that. As far as I'm aware, I think we're the only group that does do a growth guarantee. But what I really hope from all this is that we can turn a tragedy into an opportunity, because so many of us are sort of shut down. This can be an opportunity to find new ways to communicate, new ways to connect with patients, and provide healthcare even during a time of crisis. So I really hope this can be a chance for that. So with that, I would love to discuss your questions, and all three of us will be here to discuss for a few minutes. So if you do have questions, please go ahead and chat us in the chat box, and we'll be taking questions as well as some of the questions that we'd like to discuss as well. So I'm going to close out here. And okay. Anjali, Dr. Baum, are we still on?
Yes.
Great. So again, thank you both for coming, joining us today, and thank you for everyone listening in today. So first question is, can we use a telephone call and bill it as a visit? And can we use video apps for new patients? So just to start, I think there's mostly the guidance is that this is the same as with an in-person appointment. So if you're doing a video app conversation with a new patient, would be just the same as if it was in person. So there's no particular difference. So you can do that. At least during this time, and that may change after the coronavirus. But Anjali, did you have any specific information on that?
Yes. So yes, as of now, you can bill. The AMA is coming down with additional guidance on telephone and new visits. I think it's practice dependent and documentation dependent at this point. You can create a new patient physician-patient relationship via video chat and right now telephone, but I think they're going to be coming down with some additional guidance with telephone use. I'm going to recommend highly that you do a video versus a telephone for a new patient, just from liability purposes, and actually being able to see the patient as if you were seeing the patient in a physician's office. That's my recommendation. Again, new guidance comes down every single day, and they're clarifying what they posted yesterday. And so if as soon as new guidance comes up, I will notify Jonathan and to get to your practice. But as of right now, yes.
Yeah, I think we were talking about this briefly before we started the chat, but that while it may technically be allowed to take a new patient over the phone, it certainly seems to make sense that typically you would at least see the patient in person. It would be much better to be able to see the patient just from a liability standpoint, even though it may technically be allowed. Okay, we have from a liability standpoint, can we do a physical exam through video for basic exams? Dr. Baum.
The only type of exam that you can do if you're seeing the patient would be a skin examination. That would be an example of a physical examination during the telemedicine visit. There are apps available that you can do blood pressure and heart rate rhythm. That gets it's a little more complicated, but for the most part, you really can't touch the patient or you can't examine the patient. And I gave you examples where that one example that comes to mind is in dermatology, where they can see and I certainly would only use a platform that's HIPAA compliant. If you're going to show parts of the body, you don't want that out into the public sector. So that being the caveat, that is one example where it can be done.
Yeah, I think another one that I've seen too is, for example, fertility. You may do a genetic consultation where it's really just a question and answer of, have anyone in your family ever had these symptoms? And it's still an in-person appointment, but doesn't necessarily have to be. And under these circumstances, it might be a good example of one that you could also do through a telechat option.
And I wanted to add to that too. A lot of home health, there is equipment that a patient's family member may be using at home to assist with their care. So if you're seeing that patient at home with assistance of their family member in taking some sort of vitals or anything to that effect, that as well can be, you could be compensated for that and get that information and be able to see that patient in that manner.
This actually reminds me of a question that I've actually been meaning to ask. So suppose a patient actually has a thermometer at home, they take their own temperature. Dr. Baum, do we just toss that out as like we can't really take that, or can a doctor actually use that as information that the patient's reading says that it's 99.8? Is that reliable? What should a doctor do in that sort of situation?
It's as reliable as if a medical assistant did it in your office. Absolutely would be reliable. The same with blood pressure. I mean, the doctor doesn't necessarily take the blood pressure, the pulse, or the temperature. So that can be recorded, and it can be part of a element of a minimal physical exam. So that, it would be no different as if it were done in the office, face to face.
That makes sense. So we have another good question here about Anjali's recommendation that practices not record these chats and reconcile that with Dr. Baum's suggestion that one look at the recording. And I think I do want to clarify that I don't think Dr. Baum was recommending recording it. He was saying recording like physically with your pen and paper or typing or your EHR, something like that. But the idea is that once you if you record the video, you are creating that PHI that's going to exist in a permanent file. And once this sort of restrictions go back to normal, you still have that PHI to deal with, and just becomes a huge mess. But Anjali, did you have any specific comments about recording?
Yeah. Yes. And once again, I suggest that it is as if you're seeing the patient in your office, and in your office, you don't record your patient encounter. You simply talk to the patient, you document in your chart or your EHR, and then you go ahead and bill for that encounter. Can you delete it? The question is, can you delete it? Sure, you can delete it. However, there are ways to find out that information, even if you feel that that information is deleted, especially in a non-HIPAA compliant platform. A HIPAA compliant platform has a recording features. You can record. Another recommendation I have is that you have if you're in a practice that has an attorney that is your practice attorney, that is not your estate planning attorney or things like that, that if it's a healthcare attorney, that you include some of these attorneys on your recorded channel to keep it privileged information. These are probably, that recommendation is probably for medium and large size practices. I know small practices don't have a healthcare attorney on staff.
So as a whole, I think we're sort of as a consensus. You can record. We don't necessarily recommend that you record. In fact, we'd probably discourage you from recording. Do I have that
Correct.
accurate for both of you?
Correct.
Dr. Baum, did I summarize your thoughts as well?
Yeah. Regarding documentation, I wouldn't do a video recording, and we talked about a written documentation. And on the Vanguard website, we have a documentation form that they can copy and use that have all the requirements that are necessary for a E&M documentation that can then be acceptable, loaded onto the patient record, and then serves as a opportunity for appropriate coding and then billing the patient. But I wouldn't recommend video recording the patient and counting that as your as your method of documentation. Would avoid that.
Right. So, Dr. Baum, I think we have another one for you. And the question is, I have seen OB-GYNs do postpartum physical checkups through video. I wasn't sure that if this was appropriate or using a HIPAA compliant format. But I think it's more about, is this appropriate? Do you have any comments on that?
Yep. Yes, it can be done in the uncomplicated postpartum patient. Check in, see how she is doing, answer any questions she may have, and consider that a visit that you can code and charge for if you document it. Obviously, if it's a complicated postpartum visit, then you probably need a face-to-face visit. Common sense. Again, the patient calls with some questions regarding breastfeeding or regarding discharge after having a baby. These questions can easily be answered in the postpartum period, and that can be documented, and that can create a code for it, and it's definitely appropriate. I know of surgeons that are pre-operatively consenting their patients by getting the consent, a verbal consent, or using a written consent and then scanning it and putting it in the record. And then they are following these patients, uncomplicated patients, post-operatively. I know a number of urologists who are seeing patients after a vasectomy, uncomplicated, recorded in the chart, and can appropriately bill the patient, for that visit.
That makes sense. So, Anjali, a question for you is, can practices conduct telemedicine chats with people in other states? And then in addition to that, can those be reimbursed or can those be billed?
Yes, at this time they can be reimbursed, and you are seeing providers crossing state lines and seeing possibly established, it depends on your type of practice, but seeing established patients across state lines and being able to bill for that visit, as well as new patients. My recommendation again is that these licensing restrictions across state lines are going to be again restricted post-pandemic. The Federation of State Licensing Boards just came down with a 50-state survey this morning, which I've posted on my LinkedIn website, to see what you need to do to either get an expedited license in that state and or temporarily. Now, what often happens is if you have a temporary license in that state, that license post-pandemic will be approved should you, to a regular license. Right now, you can see patients across state lines and bill for that. However, just realize that the standard of care, the scope of practice, then you're liable for the standard of care in that state. Take those things into consideration before you do a cross state lines visit.
Can I
And
ask you a question, Anjali? More for you to tell our listeners. Suppose you have a 5 to 10 man practice, and they don't have in-house legal counsel, and they're interested in getting involved in telemedicine. I'll ask both of you, what would be involved in getting an attorney? What kind of counsel would they need to have? What kind of advice would you give them? How does the doctor connect, or the practice connect with you? How do you advise them? And then, Jonathan, would you answer, suppose a small practice wants to do some of these free video chats. Most doctors, certainly middle-aged and older doctors, are not going to have the skills to do it. Probably some of the millennials do. What advice do you have to them that what Vanguard Communications can do for them? So how would both of you recommend managing that 5 to 10 man group? Anjali first.
So first, again, I recommend coming to a healthcare attorney that understands state laws. You have licensing laws, you have entity formation laws, you have laws called corporate practice of medicine. In certain states, they allow non-physician ownership of practices or in charge of practices. Most cases, in most states, they do not. The physician has to be the head of the practice. From my standpoint, I operationalized a telepsychiatry practice across 30 states. So doing that, I looked at every state law regarding telemedicine, HIPAA, data privacy and security issues, licensing issues, supervision issues across state lines. In certain states, you can have a full-time, there's a limited number of full-time mid-levels that you can manage. So these are all things that you take into consideration before, one, you want to go cross state lines, but even within your state, how do I implement a great telemedicine practice to get new patients now and to get reimbursed right this second? And so I know practices are struggling. So how can we help, how can I help you get up and running right these seconds, from looking at coding to getting you to the right vendor to get your platform all set, and all these type of different intricacies that goes on, and how to manage even your staff remotely while you're seeing patients remotely as well.
Do you have a fixed fee, or is it on an hourly basis? How would they pay for this?
Depends on the situation, but I tend to do alternative fee arrangements, meaning I do not like to bill hourly. I come from a family of physicians. Both my parents are independent physicians and doctors. So I try to think through what exactly that practice really needs to move forward. And it's usually I love to keep them on as a retained client, but sometimes it's a limited engagement. So I try to give them a monthly estimate on, I think this is what it's going to cost. And then beyond that, it's my hourly rate. But I don't tend to bill hourly, just because then a practice can budget into their legal fees into their budget.
Okay. And Jonathan?
Yeah, I will use this and respond to that, and then I think we'll be wrapping up. So in my mind, if I was a single provider independent, I would say, I would just remind you that the resources that in the press releases that have come down from HHS and OCR and CMS are linked on our website, so you can get access to those and read the guidance for yourself. And we are certainly available for practices that are that we're working with now, that you can reach out to. I guess I just put myself in your shoes. I would reach out to a lawyer and a marketing firm simultaneously, because this is moving so quickly that if you wait for one to agree with the other, by the time you get the back and forth, you might be a little bit late. The thing is here is this is a difficult time, and I think the bigger question that practices want to ask themselves: do we want to offer some sort of telemedicine? And if you do make that decision, there's going to be resources for you. The guidance has been opened, the rules have been opened up, so you have opportunity to do this. And figuring out the details, then reach out to a lawyer, reach out to experts in those fields, and there'll be resources to help you. Does that sound good to you both as well?
Well,
Of course.
the message that I think we want to get across is it requires a combination of both. Unless you have the wherewithal to do the technology in your office, it requires a firm that is able to do this. And then I think you have to have good legal counsel about what you are doing to manage this, stay out of trouble, and not go afoul of the law. So I think the take-home message to the audience is you need to have both.
And one more ending note too, and I think this will all reemerge. If you decide to do telemedicine in your practice, the first person that you need to call is your malpractice carrier and notify them that you're providing care via telemedicine. They are going to be covered at this point, and if you're in Illinois, it's me. If I don't know who your medical malpractice carrier is, but the first phone call you make is that I am providing telemedicine services now.
Good point.
Final thing on that, you send it to them in writing and request a confirmation in writing from your malpractice carrier that you are covered. So you don't go verbal on that one. You need to tell them in a written format, and they need to respond to you and confirm that you are covered, at this time for conducting telemedicine. Agree, Anjali? Yes, you do.
Yeah, correct. Agree. And I prefer, documentation in a certain amount of documentation, but definitely you want that. And if you need information on a malpractice carriers that do global, malpractice policies in this area, if you're doing across state lines, I have information on malpractice carriers that you could contact as well.
Good. Great. Well, thank you everybody for joining us today. Again, I'm Jonathan Stanley. This was together with Dr. Neil Baum and Anjali Dooley. So thank you all for joining, and we'll be in touch. Bye-bye.
Thank you.